What are the possible side effects of Botox?
Botox, which is a brand name for a type of botulinum toxin, works by preventing the transmission of signals from nerves that stimulate muscle contraction, which then results in the reduction of muscle movement. Botox and other neurotoxins can reduce the appearance of lines and wrinkles that appear when muscles are engaged, while still retaining a natural facial appearance and retain normal facial expressions. During consultation, my patients will express their concerns about Botox after they see celebrities who have an overly smooth facial appearance or a paralyzed looking face lacking in facial expressions. Fear of looking like one of these expressionless celebrities can be a cause for hesitation. I'll discuss how I've been helping my patients look better and look natural with Botox and other neuromodulators since 1993. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I was among the first group of doctors to use Botox in the early 90s for medical conditions such as benign essential blepharospasm and hemifacial spasm, well before the indications for cosmetic enhancements. As I mentioned earlier, Botox and other neurotoxins such as Dysport, Xeomin, and Jeuveau temporarily reduce muscle activity by disrupting signals between nerves and muscles with effects lasting typically for 3 to 6 months. Celebrities and people who believe they are celebrities are often described as being over-Botoxed. In my experience, this wax figure look occurs because of a shared belief between the patient and their practitioner that a youthful appearance is characterized by no facial lines or porcelain doll-looking skin. Although it is less likely to see significant lines and wrinkles in someone who is in their 20s, there is a point of distinction to be made here. A young face is not an expressionless face. Further, a youthful face is also characterized by facial volume, skin quality, and proportionality. My philosophy that informs my approach to neuromodulators, injectable fillers, lasers, and surgery is to help my patients look their best for their age. This means targeting muscle activity to reduce the depth of lines associated with facial expressions while preserving your ability to express emotion. The last thing you want is for anyone to be distracted by your lack of natural facial movements. Another issue that occasionally arises is the neuromodulators affecting muscles that were not intended to be treated. For example, the placement of neuromodulators to treat horizontal forehead lines can result in the eyebrows drooping and causing the eyes to appear more hooded. Occasionally, an eyelid can droop from the neuromodulator affecting the muscle that lifts the eyelid, called the levator muscle. Sometimes a patient will persuade their injector to treat their crow's feet lines outside of the safe perimeter of the eyes, resulting in the neuromodulator affecting the muscles responsible for elevating the cheeks, such as when smiling. Generally speaking, the dose affecting these muscles are relatively low, and the unintendedly affected muscles return to their full function in a few months. Botox and other neuromodulators are amongst the most popular non-surgical procedures in the world. These products are injected by non-physicians as well as physicians who are trying to supplement income lost from being underpaid by insurance companies for their appropriate medical services in their specialty. Sadly, numerous physicians have abandoned their core training to perform aesthetic services due to frustration and burnout from practicing what they were originally trained in. At this rate, the shortage of doctors and other medical professionals to help people in need of medical attention will continue to get worse. This means that there's a wide range of practitioners with experience and expertise that is less than optimal. Further, it's no surprise that this many injectors simply don't know what they don't know and oversimplify what they think they understand, causing less than desirable outcomes and avoidable complications. Oftentimes, aggressive advertising and discounting drives consumers to these types of practitioners. These practitioners who offer these low-cost services have to see a lot of people, and in doing so spend less time being deliberate, methodical, and thoughtful about how they are treating their patients. This invariably results in people being subject to more risk and dissatisfaction with their results. These same practitioners are also less likely to be responsive and available to people they treat, which is consistent with their low-cost business model. Naturally, it makes more sense to select a specialist with a high level of expertise and experience who will be available to you when you need them. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.